And going in depth now about testing guidelines for the coronavirus. Our newsroom has gotten several emails and phone calls from people asking why their own doctor will not test them when they feel sick. ABC Action News reporter Heather Lee finding out what doctors look for and the new way patients can figure it out on their own.
Continuing concerns over the coronavirus have people in the Bay Area questioning their doctor's decision to not test them for the disease. Strict guidelines and certain symptoms are helping doctors decide who needs to be tested for COVID-19. Tests are being preserved for the cases that meet the priority criteria.
We have a really experienced group of individuals, and they've been trained, they've been tested, and whether it's the COVID-19 disease or influenza, they know what signs and symptoms to look for.
Traveling to a high-risk country, developing symptoms like a cough, fever, or shortness of breath after traveling, or being around anyone that has tested positive would likely require you to be tested.
I think we need to really preserve the test for the individuals that are high risk and have the symptoms.
Friday, Dr. Deborah Birx, the coronavirus response coordinator in the White House, announced a new screening website through Google for COVID-19 testing. Users will answer a series of questions regarding symptoms and risk factors. If they qualify, they will move on to the next step with directions to the nearest drive-through testing clinic. The test will be sent to a lab, and the results will eventually appear on that same website within 24 to 36 hours.
But we want to try to figure out if we could identify, how much more prevalent it is amongst some of these populations which are not exhibiting very significant symptoms. Again, those are going to be younger populations and healthier populations.
Which could happen when more tests are readily available. Heather Lee, ABC Action News.